Good to be inside and not outside and all of that rain and having to battle that.
I know. I thought I was going to have to swim out here this morning.
A shout out to anyone who has to be out in it. My condolences.
Yeah, and be safe. Though we're used to it. We have web feed around here, right?
Yep, exactly.
So tell me what's going on at the hospital. I think we've got the Optimize Your Brains coming up.
We have a lot of classes, and for those of you who know Ginny Gable, you know that she can put on a truckload of classes. And what we're really looking at in conjunction with the Year of Wellness is to really have a lot of options for people who want to learn more about how to make their life more healthy. So Optimize Your Brain is a new class. If you want any more information, just call the hospital and ask for Ginny. And they've got information on the Year of Wellness website. And Dr. Nedley is working. This is one of his programs that we're going to bring here. He was here in January and a packed house. Yeah.
I went to a few of his lectures.
How did you enjoy it? Okay.
Yeah.
Good.
And big crowds. You can tell people really want education about the brain and are jumping on board with the Year of Wellness.
Well, nobody wants to be sick. I was just doing some leadership rounding on second floor at the hospital, and everybody was like, I want to get well. I want to go home, and I want to get back to my life. And so we all want to have that wellness and have that optimal brain function. And so looking at some of the classes about Optimize Your Brain, and as you and I were talking about earlier, chronic pain management, powerful tools for caregiving. How do you take care of someone? How do you take care of yourself if you're in pain all the time? How do you learn how to cook better? How do you learn how to deal with diabetes? There's like all kinds of classes that we have.
People wake up and they go, oh, I'm really in a pickle. They go to their doctor's office and say, okay, we have to really jump on board, or there's a lot of medications and all these things that person's going to need. So walking away from that and that reality is, what do I do now? Where are the resources? And it's so neat that Tillamook just has come together, and the hospital is so involved in putting all these programs together so that it's not just about people don't have to feel like they're by themselves, right?
No, absolutely not. You have lots of friends in Tillamook County who are interested in having a better life, and one of the classes that's coming up is CHIP, and there must be at least 400 people in this county who have been through CHIP, Complete Health Improvement Program.
There it is, yeah.
And they have learned how to be more active in their lives. They've learned how to cook differently, how to eat differently, how to keep their mental outlook such that it's not a chore to live healthy.
Right.
It's a positive choice, and you make those choices every day that help you to live longer. And so you're not in the doctor looking at this long list of medications going, oh my gosh, we got to do something here.
And that is a class that it's several weeks, right? It's not just you go for one time. You're there really learning and kind of building on information.
Exactly. The next one coming up, for example, goes from March 28 to May 3. So you're there like several nights a week. They do a cooking demonstration. So you get to see, this is how you make this. Oh yeah, this is what this tastes like. It's not half bad. I think some people have the idea that if you eat healthy, it's all going to be tree bark.
Right. It's not going to taste good.
Yeah,
we're sacrificing.
It can taste very good. Now, you might have a time where you need to retrain your taste buds, but it can taste very good indeed. And, well, in our house, if something doesn't taste very good, my husband just kind of dumps some hot sauce on it and calls it good. So information sessions are coming up for the next CHIP session, and that's where it's just free. You just go, you ask questions, you find out about it, and then you can figure out, is this something that I'm going to be able to try? And it does have a cost, but a lot of insurances now are covering it, and so.
And my understanding is that you get your blood pressure checked. You get all kinds of blood tests and screenings and things like that as well, right?
There's a I started to say a battery of tests, but that's not really a good way to say it. But there's a range of tests that you do at the beginning and then at the end, and I think there might be something in the middle, but I'm kind of flying blind here because I haven't been in the class. Ginny, if you have any questions, Ginny's the one to talk with. But you pre and post, and people lose weight. Their blood pressure goes down in like the first week.
Yeah,
it's
medications
incredible.
Get changed, or all those kinds of things too. And I love that it's really, really great tools so that you can make good choices and move on in the right way. And I have a lot of people that I work with through my agency that have been in that program, and they just rave about it. So it's very exciting. And again, that's March 28th through May 3rd.
And the information sessions are going to be March 15 and 17. So
neat.
just watch for that. There's a Better Health calendar that gets published in the Headlight Herald every month. But with any of our community health education classes, you can always just call the hospital and ask for Jenny Gable.
Right.
And they'll connect you, and you don't have to remember a phone number. You don't have to remember a website.
That's the perfect, yeah.
But we do have all that on the website as well.
Mm-hmm. And then let's go back to that chronic pain self-management program. That started this week, but is there still time if someone was interested in hopping on board? I know that sometimes that's a possibility.
I would imagine if you can get into, at least this week or early next, just give Jenny a call, and she'll be able to help you understand, how that works.
Yeah. So
there's another one coming up.
October. Yeah. So that's the great thing. These there's living well with chronic conditions, the chronic pain self-management, and diabetes self-management. So you guys are offering some really neat classes.
Well, and we have a lot of partners in the community that are helping with this too. I'm looking at the bottom of a couple of these flyers. The Northwest Senior and Disability Services is an incredibly supportive partner, and we're just glad to be able to work with them, with Year of Wellness, with all of the other groups in our community that are so interested in helping people live their best life possible.
The collaboration here, it always floors me. And if people are interested, there's still time to get signed up for the Year of Health and Wellness. You can go on the website. It's Tillamook County HealthMatters.org, and there's going to be a new challenge that's going to be coming up soon, and you can go on there, sign up, you log in. It's really easy, and you're able to win prizes and become more healthy through all these programs, and it's super fun. So, and then tell me about the powerful tools for caregiving. That's a big one too that I know that the hospital and Northwest Senior and Disability Services partner with.
We have a lot of older adults in Tillamook County, and a lot of them have family members that are taking care of them. And on one hand, as you're taking care of a family member, you feel like you're supposed to do that. It's the right thing to do.
Course.
You love them for the most part. But sometimes it gets overwhelming, and it's okay to ask for help. It's okay to reach out. It's totally okay to admit you're overwhelmed. And
it's a big job, and it's 24/7. There's no breaks,
So learning some tools for caregiving, decision-making, family dynamics, and some of those things, this class can help with that. And then there is respite care available for your loved one. Wellspring Respite Day Center is at the Adventist Church now every Wednesday, I think.
Every Wednesday. I think it's 10 to 4.
10 to 4. And so we can make arrangements. Arrangements can be made for your loved one to have care while you're in the class. And I can't imagine you would go to the class and not learn something. Some of the clients that you've worked with, Stacie, probably have.
Right. I have lots of people that have been through that class, and they really do learn some skills on if the person, whatever the person's diagnosis is, if they have dementia, they can kind of learn some things about how to manage that. Self-care, which is so important. Nutrition, avoiding falls, safety. The list goes on. And the neat thing is the Family Caregiver Support Program that I work with at Northwest Senior and Disability Services can provide some respite dollars with no financial screening. It's really just about trying to take care of that caregiver, and they can pay for some of the respite care if somebody wanted to go to Wellsprings, or so that's an extra little bonus, so that we really want to take care of those people so that they can stay in their homes.
And they have so much fun at Wellspring.
Oh my gosh, it's a hoot in there, isn't it?
Like crafts and snacks and singing, and it's like, oh, okay, someday maybe can I go to Wellspring?
Right.
But
Absolutely.
it is totally a loving, caring environment, and I think anybody who is taking care of their loved one at home could feel completely safe in being able to trust them to those volunteers and the leaders there.
And they have a nurse on staff while they're there, so there's really great medical oversight. And if someone needs medications throughout the day, or insulin dependent things like that, we're going to take a little break here, and this is just a word from our sponsor. So Tillamook Regional Medical Center Tillamook County's Early Childhood Screening Fair is March 2nd, 3rd, and 4th at the fairgrounds. Your child will receive needed immunizations, exams and screenings, physical, nutrition, hearing, behavior, vision, childhood development, dental, speech, and other screenings for free for all 2 to 6-year-olds, regardless of income. Call today for an appointment at 503-815-2292. Tillamook Regional Medical Center is honored to lead this community-wide project, which can only be accomplished through the support and involvement of so many local and regional partners through the school district, the Northwest Regional ESD, Head Start centers in Tillamook County, the Tillamook County Health Department, OHSU, Oregon State University Extension Office, Tillamook Family Counseling, and more. Make your appointment today at 503-815-2292. And again, that is coming up very soon, March 2nd, 3rd, and 4th. And I'm here with Melody Ayers from the hospital. If you're just tuning in, we're going to start talking about this early childhood fair. I'm very excited to hear about this.
So if you've grown up in Tillamook County, you probably call it MultiMods, and you've probably been out to the fairgrounds and you've done the whole thing. And so we still have this community-wide program going on, and I believe we're almost at like 45 years that this has been going on in Tillamook County. And
what an opportunity for people.
Yeah, and it's a tremendous partnership with OHSU. We have a number of their professional students come over and get some practical experience doing that. Quite a few people from in the community. This year, what we really, really want folks to know is that if transportation's a barrier, we've got transportation available.
Wow.
We've got some drivers. Don't worry. We're not going to stick you on the bus and make you be traveling all around all day with that. It just got kind of complicated for some families. And so when you call into that 815-2292 scheduling number, just let them know that you have a transportation situation, and they will put you on the list, and we'll get you set up, and someone can be out to pick you up. And
it's really important that age group 2 to 6 that they get those screenings, right?
Well, yes, and even if you've been to your primary care provider, your doctor, this goes way above and beyond anything that you could get from any one local provider.
Okay.
This is, they've got vision. They've got these little vision glasses they put on them, and they can really identify quite rapidly if there are any vision problems. This is not just looking at the alphabet 20 feet away and trying to figure out what you're looking at. So they've got that. They've got hearing screening, speech screening, some folks that are really involved with the behavioral development and being able to say, there's a couple of, there's some issues here you might want to have follow-up with. And so then as things are identified, then you can be connected with professionals for follow-up care.
Right. And that's great. You can go there and maybe identify some things early so that you can get the care you need for your child. And the referrals are there so that you don't walk away going, okay, now I have all this information. What do I do?
What do I do? Yeah. Exactly. And I've heard a couple of stories from folks recently where they took their child through and they didn't realize their kiddo couldn't really see all that well. They really fake it well.
Right. And people think behaviors immediately when maybe it's a child that just needs some basic things like a pair of glasses.
And you wouldn't have thought that, and even if they've been to the doctor, it might not have been caught, but with this kind of screening, you can catch more of the things that could be issues down the road and, catch it quick. Then you can just take care of it and be done with it.
Good. Well, I love that you guys, the hospital is so involved in making this happen and doing the transportation too. That's really important. So you're really crossing T's and dotting I's. And again, that's March 2nd, 3rd, and 4th, the Early Childhood Learning Fair. And that used to be the MultiMod. Yep. So that's if anybody's confused by that, it's one and the same. So
well, there were people who were confused by the MultiMod name, and now they're confused by the Early Childhood Screening Fair. And
that's why we're here. We're clearing the air. Everybody knows
we
now.
are, yeah.
That's great. So what else is going on? Now tell me about this telehealth pilot project. I am so excited about this for our seniors, but it really is across the board for anybody that might benefit.
Well, exactly. The main job that I do at the hospital is working with fundraising, and grants are more than half of the funds that come in, the donated funds that come into the hospital. And through the state Oregon Health Authority, there was an opportunity about a year ago to apply for some funds to test out some telehealth projects here in the community.
And tell me what telehealth means.
So telehealth, anytime you're face-to-face with your doctor or a caregiver or anything like that, that's one thing. But if you have somebody at a remote location and there's not
we have a few of those around here,
well,
right?
you can drive down some driveways and you're in a remote location. But if you have someone in a remote location and it's either not convenient or it's not really a good idea to move them, for one thing, we have home health care and we have nurses that can go out there. But what if you don't really need full nursing care? What if you need care? What if you don't need, you need care too? And so we already have 4 ambulance stations around Tillamook County.
Right.
What if we made each one of those ambulances a secure hotspot?
Wow.
What if we put tablets with those ambulances where people, after they're out of the hospital or even if they've just had a doctor's appointment and they say, that person, if we don't make sure that they have their medications, if we don't make sure that they're weighing themselves and making sure that their congestive heart failure is not getting out of line there, what if we could send one of our ambulances out just to do a house visit?
Yeah, for safety.
For safety, they can make sure they've got their medications filled. They can do whatever needs to be done. They can identify that in the house. And what if their tablets, through the hotspot on the ambulance, could enable a secure video chat with the provider's office?
If you bring the technology, look what can happen. Woo.
Yeah. So we've been testing this out. We've had a little snafu with getting the right tablets in place, but we're just about there. And being able to fully test it and to be able to say, okay, Mrs. Jones was discharged from the hospital. We're going to have one of our telehealth paramedics just do a home visit, a checkup on her. They will call ahead of time to schedule the appointment. They're not going to just show up in your door and say, wow, surprise, we're here.
The ambulance is here. What did I do?
Exactly. I didn't call 911. So they will call ahead to make an appointment. And then they'll come out and they'll just do a basic assessment. How are you feeling? Oh, you're still short of breath. Okay. Have you weighed yourself recently? Do we know if you're gaining fluids on your lung or something?
Sure. And
then if the person said, Mrs. Jones said, oh, but I haven't had a chance to get my medicine that was changed yet, then they can make sure that happens.
So they're doing referrals as needed. Getting that
anybody who's high risk, we can have an ambulance, a telehealth paramedic go out there, and then eventually we're not quite there in the testing yet, but eventually they'd be able to video chat. They say, okay, Mrs. Jones does not look good, so they'd open up a video chat with a care coordinator at the clinic and say, here, care coordinator, take a look here, and they talk directly with Mrs. Jones, and they're like, you're right. We need to get her, it could be something that she needed to go and see urgent care for. It could be something that they say, let's get her back into the doctor right away.
Right.
And so the care coordinator can make that happen behind the scenes. Eventually, we'd like for them to be able to see their doctor from their home. But we're still waiting for public policy and reimbursement and license things to sort out with that.
But what a great first step.
Yes, and we're getting that set up and able to test that. And so the grant through the state health authority then is covering the technology that we're putting in place and the testing that we're doing and working on the process and all of that. So if you or your loved one gets a call from the ambulance service that says, hey, we'd like to do a home visit, this is probably part of what they're doing is using our telehealth grant to begin to test and say, how can we help people? How can we keep people better? And keep them out of the hospital.
Exactly. That's where I was going to. It minimizes rehospitalizations for those people that are at risk. And so how do you identify a high-risk person? Are the referrals coming from medical professionals at Tillamook Regional then?
Yes.
Okay.
The case managers at the hospital, as they're discharging you, they have a check mark box that they can flag to have this be a referral. As well, the care coordinators in the clinic can say, we just saw Mrs. Jones at an appointment. She's not scheduled for 2 more weeks, but if something goes wrong, it's not good for her. So let's have her have a home visit in a week. So it's not a full-blown home visit like home health care. You have all this criteria you have to meet. Right now, we're just testing. It's like, what if we can just have ambulance paramedics? I mean, they have a fair amount of training, so they can assess.
Yeah.
I mean, you trust them at a car accident.
Right.
Well, they're perfectly capable and licensed to do assessments like this and to be able to help people stay healthy. And
what a great opportunity.
We'll
for
take
our
good
county.
care of you if you come to the hospital, but we'd rather you didn't have to.
And can you referrals if I'm living in the community now and I notice a neighbor that is at high risk? Is that something for Northwest Senior and Disability Services as a referral, or should they call the hospital?
That's a really good question. I'm going to go back and ask and say, I don't think we're there yet to be able to take community referrals, but I hadn't even thought about that.
Sure.
That's really good. We need to build that in as we move forward.
Well, and so I think that it's great because this is a great opportunity for people to have that medical care that they potentially might need and identify things. So if that person, it sounds like if the ambulance drivers go out there, they see the paramedic sees, oh wow, this person doesn't really have much food in their refrigerator. They can be doing the referral to us here at Northwest Senior and Disability Services. And then if it's a neighbor, the proper channel remains that you call our information and assistance at Northwest. But it sounds like there's a lot of room for growth in this program, and I'm really excited for the direction that it goes. And it just says the hospital is doing so much. It's really exciting. So I'm going to take a little break here really quick once again. For those that love to weld, Rosenberg's has what you need to get the job done. Rosenberg's carries a full line of gas cylinders from oxygen to CO2, acetylene to nitrogen. Boy, you can tell I don't weld, right? They rent cylinders and have private tanks for exchange. Don't get caught with the problem tank. Make sure your private tanks don't have grind marks on the rings. If they do, the private tank you paid for is not really a private tank. Take your tanks in today, or Rosenberg's can deliver them for you. They have the inventory to keep you covered and the trucks and people to serve you better. Stop by and discuss your welding needs, and Rosenberg's will go above and beyond to outfit you. They also stock a full line of welding supplies, including various types of welding sticks, MIG wire, torch tips, and burrs. They have helmets and goggles, just about anything you need to grind, cut, and weld. Most sizes are on the small end, but if you're a commercial user, they can get the big sizes within a day. Build it, plumb it, wire it, paint it. Rosenberg Builder Supply in Tillamook. Wow, our welders are covered. We've got lots of that going on. So
well, you're covered for quite a few things at Rosenberg. I'm really glad they're here.
Everything in there. Every time I go in there, I'm a little bit awestruck. So I am here with Melody Ayers from the hospital. If you're just tuning in, this is Stacie from Northwest Senior and Disability Services. Thanks again for being here, Melody.
Oh, my pleasure.
It's really fun to get to know you and hear more about everything going on at the hospital. The Night Cancer Institute grant is a really big deal as well, and you've been a big part of that.
That's a new partnership for us, and we submitted a grant proposal last December, and we're delighted to find out that we had won. And we are now at a Tier 1, which means we are doing a community survey. We're looking for where are the gaps, where are the needs that people have that aren't being met. We have quite a few things that we're now doing at the hospital. We have chemotherapy infusion. We have a number of services that you can get up on third floor in the outpatient therapy services.
Good.
But and we know that we have several support groups in the community, or at least a couple. But where are the things we don't know? What are the needs that people have? What is it that we could still do here if we had a clear idea of what people thought our needs were? And so Justin Hersum, a social worker at the Plaza, he and Leilani Hurleman are leading out in this project, and Justin's been plowing through the paperwork. OHSU is a research hospital.
Yeah, of course.
So he's had quite a bit of paperwork to set this survey up so that it will be statistically meaningful and valid and helpful. And so I just met with him last night, and I think we'll be able to roll this survey out in March.
Wow.
And so we're looking to have at least 100, but we'd like more than 100 because we know there'll be more than 100 people whose lives have been touched by cancer here. And so Justin and Alani will be reaching out to folks and asking for help in filling out that survey. just looking at everything from prevention all through to treatment. I guess you get diagnosis first and then treatment and survivorship. We don't often stop to think about what are the needs of people who have already made it through. You know, you don't just go, whoo, that was it. All right, now live happily ever after. There's those doctor appointments after that. There's, in some situations, you've had major surgery. So there's other issues that you're now dealing with. And so what is the full continuum? Some things we will never be able to do here in Tillamook.
Sure.
Radiation therapy being one of them. I don't see that one ever being here. But how can we make it easier for those things that we can't do here? How can we make it easier for folks to connect with that or to support them while they're connecting with that? How can we make it easier to have everything else that we can do available here? And so we're really excited about the partnership with the OHS Unite Cancer Institute and being able to do this baseline survey. They have 3 tiers in their grant program. And so our expectation is that as we complete this survey, then we will then move on to Tier 2. And Tier 2 is where you really build a comprehensive community plan.
Okay.
Here's how we take what we learned and make it into a plan.
Filling the holes. What can we really bring to Tillamook County that's going to, you know, and I'm reading here that it's one of the leading causes of death in Tillamook County. There's a huge need for us to figure this out. And
so we're just delighted to have received this grant and to be moving now through this process with the Night Cancer Institute. And what a blessing we have that it's in our region too.
And you know, it's hard for people sometimes to get out to Portland to medical appointments and those kinds of things, especially if you're fighting a disease. You know, you're tired, the transportation, family support, all those kinds of things. So having the opportunity to have some of those services here is a huge blessing.
Yeah.
So,
and for the services that we can't do here, let's do a better job of supporting people.
Yeah.
And I know we've had a number of conversations about those at the hospital. What can we do? You know, what can we do? What order can we do them in? Because, well, if money was no object, if someone wanted to just donate $100 million, we could do quite a few things, but we have to be careful stewards of the dollars that we do have and say, what can we do and in what order to benefit the most people?
Right.
And so that's just really exciting. And I just really wanted to put a plug in here, too, because in the year 2015, the hospital received $246,000 in gifts and grants.
Wow. That's incredible.
It is. We have an amazing community, and being able to point to the local donations helps us. About $145,000 of that is grants, such as the Night Cancer Institute, the Oregon Health Authority,
you
Care
can really
Oregon.
Do something with that money and really bring some services here. So that's exciting.
So we're just delighted, and just at every little bit that the people in our community give then helps us as we go out and look for these grants as well to say, yes, there's community support.
Yeah.
Yes, our community is very generous, and they care about some of these issues. And two of the programs that really benefit from individual donations are Faith in Action, which has Wellspring that we've talked about here, as well as hospice. And I know hospice is a service that once you've been served by that, or you know someone who has had that end-of-life care, there's nothing like it.
Everybody has a right to those services, and I think people forget that at times. And we have the support through our hospice services, and you guys do a great job. I always hear great feedback from the hospice team about the hospice team.
Oh, they are marvelous.
They really are.
So the support that people give, because we're a small rural hospital, the support that the community gives really goes a long way in making sure that these programs all continue and they're strong and we're able to attract grants. And I can't say thank you enough.
Oh, that's wonderful. And you know, we do have Tillamook County is a special little place because people really come together and get the job done. So I want to just take a moment to kind of recap a little bit about what we talked about today. That early childhood screening fair, again, is March 2nd, 3rd, and 4th. It is, you can call the hospital at 503-815-2292. You know what time that
they
is
start?
Each day?
They start about 8:30 in the morning and run through till about 5. So it's about a 2-hour screening. So
So call for your appointment at the Tillamook County Hospital for the Early Childhood Screening Fair, the 2nd, 3rd, and 4th from 8:30 to 5, and that'll take place at the Tillamook County Fairgrounds. I also want to remind everybody that they can call the hospital to get more information about the CHIP program, and there is one coming up here at the end of March. And there's also, starting in February 22nd as a community event, the Food Bank and the Oregon State Extension Officer are getting together to do a cooking class, Cooking Matters, and it's going to be for free class for families. And so that's another really great opportunity, and it's kind of piggybacking on some other things that the Oregon State Extension Office is doing. But you can call Hallie Hopkins at 842-3433 for more information about that. Thank you so much, Melody, for being here today. I feel like I've just gotten a wealth of information about what's happening at the hospital, and I couldn't be a bigger cheerleader for it because it's really exciting to have all these great community programs going on.
Yeah, my pleasure.
Thank you, and thank you, Tillamook. You have a wonderful day.